People, meet Jane.
Hi, I am Jane. I'm 39 years old. I'm a stay-at-home mother with 2 lovely toddlers. A year ago, I was diagnosed with thyroid cancer. I started treatment right away. The payment of my medical bills was not a problem until my husband lost his job. Now, with no insurance, our medical debt is piling up day by day. Yet I still need chemo to fight the cancer.
Meet Juan.
My name is Juan. I am 44 years old. I am a proud father of a large family of 6 boys. I work 2 jobs to provide for my family. I work for a local store by day, cleaning and running errands, and at a restaurant by night as a waiter. I have health insurance, but the premiums are so high that I even skip my heartburn medication sometimes. And now, I have this diagnosis: bone cancer.
Meet Sandra.
I am Sandra. I'm 32 years old. I lost my mother to multiple myeloma last year. She meant the world to me. I want to honor her loving memory by helping others with cancer. Sending monthly contributions to one of 1,000 faceless charities? Not for me. I want to really help a person in need. I want to know how my donation is making a difference in the life of a person.
Meet Victor.
I'm 25. I'm a medical student at Johns University. I hope to become an oncologist one day. My brother had leukemia as we were growing up. He has been in remission for a decade now. Finding a cure for this terrible disease is my life mission. In the meantime, the best that I can do is to support a philanthropic effort that provides real assistance to those who are suffering, in the same way as my brother did once.
Meet Dr. James at City Hospital.
I'm dedicated to fighting cancer by finding a cure for it. The best way to save anybody and everybody, right? Guess what? I have been trying to find an adequate number of patients for my Stage 1 clinical trial for a year now. Does that sound familiar?
Meet Ms. Du at VAKKAS Incorporated.
I'm the director of the Patient Advocacy Program in Oncology at VAKKAS. We are an established company with a good track record of successful drugs against cancer. In my capacity as the director, I am cooperating with dozens of nonprofits that provide discounted or free medications to patients in need. Of course, we are always looking for ways to extend our philanthropic activities to more patients. A one-stop, patient-centric platform where patients list their needed medications would be mutually beneficial to us and to the patients.
Meet Mr. Portner, CEO and President of the Good Health Hospital.
Just last year, Good Health Hospital had an outstanding balance of $8 million in unpaid medical bills. Hounding cancer patients to collect their unpaid hospital bills just sounds unethical, right? But how to pay the salaries of the staff and keep the hospital afloat? Patients need hospitals that can provide services, and services cost money.
Numbers. Are Jane and Juan exceptions? 3 out of 5 bankruptcies in the United States are due to medical debt. Cancer treatment often means a choice between a mortgage and good health, between a good and a ruined credit score. 1 in 5 cancer patients spends virtually all their life savings to get the needed treatment. 1 in 2 healthy men and 1 in 3 healthy women will get cancer. Are Sandra and Victor exceptions? Fundraising companies sometimes receive 90% or more of the money people donate to charities. Is Dr. James an exception? The delays in patient recruitment for clinical trials account for an annual cumulative loss of 26 years on average for each company per trial. Is Ms. Du an exception? Pharmaceutical companies lose an estimated $188 billion annually in revenues in the U.S. because patients fail to take their prescribed medication. Is Mr. Potner an exception? Hospitals in the United States have unpaid medical bills of $40 billion annually. VAKKAS.org, a platform where everyone can meet to help the patient. Sandra and Victor can use VAKKAS.org to find and help a patient or group of patients. Those with a specific diagnosis, nationwide or in a particular state, or even those in a particular hospital. And they see where their money goes, to pay chemo bills. They can make one-time or monthly contributions to help or adopt a patient. Medical professionals like Dr. James and Mr. Portner can provide the treatment that all their patients deserve with peace of mind. They can also have access to a single database to help them locate suitable patients interested in clinical trials. Pharmaceutical companies. Ms. Du and pharmaceutical executives like her can contribute medications to patients in need. And what about Jane and Juan and their families? They only worry about getting better. VAKKAS.org philanthropists have got their backs. VAKKAS.org, adopt a patient or contribute to save a life today.